So we're experiencing a nursing shortage.
Absolutely.
So if they
Very
do,
severe.
if they do away with that waiver, the nurse ratio waiver, um, I know Diane talked a little earlier at another meeting that we're hiring nurses as quickly as we can.
Right.
So if they do away with that nurse ratio, are we able to have enough nurses with the new nurses that she is hiring to not
To meet
shut
the
down?
ratios? Or?
Yeah, to meet the ratios.
Yeah, because in order to be given a waiver from the ratios, to not have to comply with the ratios, you have to agree to shut down elective
Right.
surgery.
Mhm.
So your question is, with all these new nurses that Diane is working to
Right.
bring on board, if we had all of them, could we meet the nurse staffing ratios? And the answer is no. There are not enough nurses. Again, we have probably 50 RNs that are out right now because of either, they're quarantined or they're on leave of absence. We have a lot of nurses that are coming in the pipeline, but they'll go into training
Right.
for a period of time before they'll be ready, to be deployed. So what the state essentially wants us to do, if they say you've got to follow these ratios, fine. You want to keep doing elective surgery, you're gonna meet these ratios. Well, the only way we could meet it would be to shut down beds, to literally shut down units so that we could staff 4-1 or 3-1 or whatever the ratio happens to be. And that's generally what the state says, even in non-COVID periods of time. If you run short of nurses, then you need to stop doing surgery, take those OR nurses and put them up on the floors, put them at the bedside, because that will give you nurses. Or you shut down services, you shut down floors, you stop taking patients until you come into compliance with the ratios. So I don't know how you do that. I don't know how you tell the community, I'm sorry, there's no more room. We can't take you. You're going to have to drive to another hospital who has more nurses.
Right.
So, we use LVNs, we use CNAs, we use a kind of a team approach. And when we run short, our staff step in and they pick up an extra patient. They help each other out. We do everything that we possibly can to not ever turn a patient away that needs to be hospitalized.
Right. So that is coming in the next 2 weeks.
Yeah, now I do know that the California Hospital Association, which represents the 500 hospitals in the state of California, is working with the governor's office, is working with the California Department of Public Health to modify that requirement, helping them understand, if you force hospitals to once again shut down elective surgeries, they're going to go right back to bleeding, terribly from a financial standpoint.
Right.